malaria surveillance and its readiness for elimination phase. March 2021, AHMC outline introduction, transform surveillance as a core intervention, programmatic requirements for surveillance system in elimination phase. Surveillance system in elimination phases. Proposed surveillance and readiness of the system. Introduction. Surveillance, monitoring and evaluation. Surveillance, monitoring and evaluation is a critical component of elimination in guiding the deployment of specific interventions and the evaluation of progress and impact. A surveillance system consists of the tools, procedures, people, and structures that generate information on case and disease, which can be used for planning, monitoring, and evaluating. The design of malaria surveillance systems depends on two factors. These factors are: one, the level of malaria transmission, and the second is the resources available to conduct surveillance. An effective malaria surveillance system enables program managers to identify the areas or population groups most affected by malaria, identify trends in case and disease that require additional intervention, example, epidemics. To assess the impact of control measures or interventions. Surveillance system in elimination phase. When a malaria control program transitions to elimination, the surveillance system must change. This change includes rapid notification of individual cases, geo-referencing cases, prompt response, and FOSI investigation. Program should incorporate transitions that occur in the shift from control to elimination, even if elimination is a distant goal. Surveillance system elimination phase. The program is going to transition to elimination phase. Elimination phase means optimization, pre-optimization, elimination, prevention of reintroduction. Global Technical Strategy for Malaria 2016 up to 2030. From framework, pillars, and supporting elements. Global Technical Strategy for Malaria 2016 up to 2030. Pillar 1. Ensure universal access to malaria prevention, diagnosis, and treatment. Pillar 2. Accelerate efforts towards elimination and attainment of malaria-free status. Pillar 3. Transform malaria surveillance into a core intervention. Supporting element 1. Harnessing innovation and expanding research. Supporting element 2. Strengthening the enabling environment. Question for brainstorming. Questions. How do you transform the existing surveillance system to become a core intervention for malaria elimination? Transform surveillance as a core intervention. Early step to strengthen surveillance system to become an actual intervention. 1. Testing all individuals with suspected malaria, recording all confirmed cases, enhancing the quality and timeliness of the case reporting through training, supervising, and retraining. 4. Including community case detection, confirmation, and reporting. 5. Including case detected by all parts of the health system, example, public, private, NGOs, military, etc. 6. Developing reference laboratory capacity for verification of parasitological diagnosis. 7. Building system for reactive case investigation. Transform surveillance as a core intervention. Elimination involves institutionalization of surveillance activities. Method of institutionalizing. Establishment of elimination health information system or database, recording the immediate notification of cases, identifying active transmission areas, or forcing and guiding the targeting of interventions. Undertaking active case detection or ACD to guide case and force identification and investigation, followed by response. Linking surveillance with response. Deployment of interventions. Thus, institutionalization of surveillance involves Ministry of Health or National Malaria Elimination Program is committed to establish a surveillance, monitoring, and evaluation system that serves the purpose. 2 systems, DHIS2 for health facility and ECHIS for community level, are identified. Customization and piloting of the tool already completed. Countrywide roll-up started. Programmatic requirements for surveillance system in elimination paths. Legislation make malaria is mandatorily notifiable disease immediately. Staffing national, regional, zonal, district, and health post. Recruit additional staff or task shifting for the field work functions. Invest in cascade training. Reorientation of staff. Creating malaria testing and treatment posts in active force temporary. Health posted in persistent force or new force where focal malaria transmission. Laboratory support for surveillance and quality assurance. Involvement of the private sector, supportive supervision and mentoring. Surveillance in the optimization phase. Purpose: intensification of the existing interventions in terms of quality, targeting, and utilization. Surveillance in the optimization phase will be similar to the control phase with intensification of quality and utilization. Features of surveillance in optimization phase: passive case detection, PCD, temporal and spatial trend analysis of aggregate data, line listing of inpatient and malaria-related disease, weekly monitoring of cases, monthly summary of key indicators. Data analysis in optimization phase, aggregate data analysis, given the high frequency of malaria cases and the relatively limited resources. Malaria surveillance system rely on aggregate data being supported to and used by district and higher administrative levels. Malaria inpatient case and disease audit at selected health facilities, cases-based surveillance Case-based surveillance of malaria inpatient case and disease audits should be undertaken with the aim of understanding and responding to cases of severe disease. In addition, audit of inpatient case could also inform program weaknesses related to preventive interventions, treatment-seeking behavior or referral systems, monthly summarization and visualization at health facility, district, zonal and regional level. Cases and disease should be summarized on a monthly basis in order to assess the success of interventions and identify trends that need an urgent response. Surveillance in the pre-elimination phase. The purpose of this phase is to further reduce transmission and introduce additional approaches and tools to the optimization interventions, making surveillance a core intervention through establishment of an enhanced elimination health information system to identify high transmission areas, transmission forces, and guide targeting of interventions.